Afternoon. It is now 1:14. The meeting will come to order. The next item of business is a report from the LSU HSC Human Developmental Center. The chair recognizes Ms. Constance Alphonse for the report.
Good afternoon. Hope everyone had a great lunch. Thank you. I'm filling in for Dr. Wilson today to provide the update from the Human Development Center. So you guys all received the report. We're on the, yes, the blue paper. And so I'm just gonna go through some highlights I wanted to point out from the report. The first one from our early childhood initiatives. The Early Head Start Center did provide professional development to child care partners. And so on May 22nd, there were 72 teachers that participated from 7 different centers. And they covered topics in that PD with harmony and learning, executive functioning in toddlers, as well as supporting emotional regulation in the classroom. They also did professional development on May 17th with 19 teachers on site that covered those same topics for an additional center. And then they also hosted PDs at our HDC building for over 60 childcare centers in July and August. They also have a parent training series going on, which are 10, they're supporting 10 families in conscious disciplined parenting to really help parents understand how to help their children manage their emotions and their thoughts and their feelings and behaviors. Under our Louisiana Deafblind project, some highlights, they actually hosted an OSEP leadership team visit. And so OSEP leaders came to our Human Development Center building and did a site visit and had discussion with the project staff. One of our interveners attended a national training to get her national certification. And interveners are highly trained paraprofessionals who specialize in deaf blindness and really support helping that individual with deaf blindness integrate in and be able to work. And they work one-on-one with individuals with deaf blindness. And then the Deafblind Project has also entered into a data sharing agreement with early hearing detection and intervention to help improve early identification of infants and toddlers who may have deaf blindness. On our LaSard project, we currently have 50 contracts with 38 school districts and charter networks throughout the state. And then finally, under our community health initiatives, we have a collaboration with the Split Second Foundation where we hosted a multiple sclerosis support group. And then we're continuing to provide educational and vocational support to treatment after chemo and late effects clinics. And then as we're in the process of opening up our FASD clinic, those staff members went and observed different clinics at the University of Washington and the University of New Mexico to give us some ideas of what we can do to implement as we look to open our clinic. And then we continue to provide some developmental screenings with We Play Training Grounds Childcare. And then we also provided technical assistance for the American Muslims for Accessibility, Advocacy, and Nurturing Acceptance, which is a local support agency in the greater New Orleans area. Finally, we are doing FASD with talks with DCFS, and they're going to be at regional centers, really to provide parents with information on FASD home supports, information about FASD in general. The sessions are going to be scheduled across the state. They're still finalizing those dates, but the sessions are tentatively scheduled to be held in New Orleans, Lafayette, Alexandria, Shreveport, Baton Rouge, Covington, Monroe, and Thibodaux. And they are going to offer 2 different time frames just so they can reach a wider audience. So one will be a daytime mid-10 to 12/1 session, and then they'll have a later evening session 5 or 6. Any questions?
You were speaking to the one about parents, about the discipline.
That already happened, or
That has already happened.
is that recorded, or,
I do not know if it's recorded, but I can find out and get back to you and let you know.
okay, and, I noticed, the long-term training on the leadership education and neurodevelopmental and related disabilities. Is that gonna be something that's ongoing?
Yes, we have a different cohort every year.
Okay.
And so the applications generally open, I guess, in February or March. And so the cohort goes through the training from the first week of August all the way through June. I'm actually a Lynn trainee myself.
Oh, awesome, okay.
And Lauren, if you Google conscious discipline, there's a ton of information that teachers use this in their schools and in their classrooms.
Okay, just,
Any other questions? Any questions from the public? No? Okay. Hearing none, the report requires no action and will be placed on file. The next item of business is a report from the Louisiana Rehabilitation Services. The chair recognizes Melissa Bayham for her report.
Hey, everybody. Excuse me, my report is on this right. So with every quarterly report, there are some statistics on the number of, excuse me, consumers served in pre-employment transition services and in vocational rehabilitation. We did add at the end of the first page, y'all have requested the percentages for compliance for what we call our 60-90, which is we have 60 days to determine eligibility and 90 days to determine or to develop new individualized plans for employment. So as you can see, we have last quarter we're at 85% and 86%, and we need to get to 90% for compliance. The second page is just again more data that y'all have requested on open cases in vocational rehabilitation, rehabilitated closures, and services provided by our rehabilitation employment development specialists. Our Louisiana Rehabilitation Council we usually meet the week after this meeting, but I will be out of town for a national conference. So that meeting is actually going to be on November the 7th at the Hampton Inn and Suites. And so you can find more information about that meeting on the Boards and Commissions website or the Louisiana Workforce Commission website. We also have information on benefits planning. Certain LRS participants were directly assisted with their SSI and SSDI benefits planning since July the 1st by our LRS in-house community partner work incentives counselor or SCUIC. And our consumers also have the opportunity to also continue to receive services through Lighthouse for the Blind and LSU Human Development Center for those services. The Disability Innovation Fund project that we had with Michigan Rehabilitation Services and Southern University of Baton Rouge has ended, but we do continue to serve those participants through the vocational rehabilitation program. We also, I reported this yesterday, we are in the midst of doing a statewide training for all of our counselors and supervisors. We entitled it the VR Journey. This is just, we have a lot of new staff, and we also had a lot of changes this year. And so this is just kind of trying to help reset some things and just provide more consistency statewide of LRS services, because it's really important to me that no matter which regional office you go to, you get the same services. So we are in the process this quarter of training all of our district supervisors and our rehabilitation counselors. I also wanted to thank the DD Council for promoting our comprehensive statewide needs assessment. This is a needs assessment that we have to do every 3 years as part of our state planning. So we just finished that. That survey has just closed, and we are in the process of contracting with LSU Shreveport, who will be analyzing that data and providing the assessment report for us for our next state plan. So that's something, an assessment that we use as a planning tool for the next 3 years. And just want to mention, I talked in depth about this yesterday. But when you see, like in terms of like the performance for our eligibility and IPEs and the deficiencies there, we are understaffed at this point and we are underfunded. And just to reiterate, the vocational rehabilitation program in Louisiana sent back $29 million of federal funding this year because we don't have the state funds to draw down our federal drawdown. But the good thing that I want to point out, and it's under pre-employment transition services, the easiest way to generate federal match for federal funding is through state appropriations, but we also can use third-party cooperative arrangements. And these arrangements have to be done with public entities. So all of we have 19 right now, they're all with school districts. And we use those third-party cooperative arrangements to pull down the federal funding for transition specialists in those schools. And so the Department of Education has a Disability Innovation Fund grant where they're helping to, I guess, provide models for that, so that hopefully more school districts will want to participate in this. We have 2 new ones coming up in Lafayette and I forgot the, I'm sorry. Yeah, I think so. Those are the sheet paper. Yes, Lincoln and Lafayette. And we are in discussion with Bienville, St. Charles, Morris Jeff Schools, and Algiers Charter. So we continue to have interest in this, and it really is, in my opinion, one of the best ways to provide pre-employment transition services to students with disabilities, because these contracts allow school districts to have their own transition specialists within their districts under the supervision of our program, but they are employees of the school district, and they're with the students full time. So we continue to advocate for more school districts to participate in those because last year I think we were able to generate $1.5 million in match from third parties, and this year we're anticipating $2 million. So that is a way for us to generate match without state general funds. So very appreciative of that.
So that's the, thank you, Ms. Bailey. Are there any questions from council members on the report? Lauren?
This is just a suggestion for future meetings. I think that the our journey is right. In the future, if you'll have time or even getting it from LWC, if either you or one of your staff could do presentations to the workforce regions, the one stops on how LRS works, because there's a lot of information.
Right.
It's information on those levels. Just getting the coordinators and the directors of those regions might be a great way. Whoever's doing this training to roll out some training to them.
And you made me think of something, Lauren. So October the 30th and 31st, there is a board directors meeting. This is between, it's for the Office of Workforce Development administrators with the local Workforce Development Board directors. And I am doing a presentation on LRS at that meeting.
Oh, awesome.
Yes. Okay. And so at that meeting, not only am I going to be discussing what LRS services are available to their participants, but I'm also going to be talking to them about accessibility in the American Job Centers and the need for not only physical accessibility, but for accessibility to all workforce programs for individuals with disabilities in the American Job Centers.
Jill?
What does it mean when you say the amount of funds were left on the table?
So every year there's an appropriation for each state. Technically, there's 78 VR agencies because some states have a general agency and a blind agency. In Louisiana, we have one agency, and that's LRS.
Okay.
And so every year, the federal government allocates a certain number of funds to each state agency. For LRS last year, I believe our allocation was around 64 million. This year, our allocation so far, federal government hasn't finalized their budget yet, but it's anticipated to be $70 million. But in order for us to draw all of those federal funds down, we have to have the state funds to draw the match. So last year, we were only able to generate in state general funds or local funds through those third parties to draw down 34 million. So we sent 29 million back, which means we say we send it back, but we never really have. Because we never got to draw it down. So, and what happens with those funds is they get put back in that VR pool. And other state agencies, if they have additional match, they actually get our money. So this year, all state agencies who return money, other state agencies were able to draw down their funds.
Oh,
Because when for several years, VR agencies were not able to draw down all of the federal funds. And that's where the Disability Innovation Fund grants, like the one that the Department of Education has, that's where that comes from. But this year, all the VR agencies were able to draw down all that money, but we weren't able to draw down all of our funds. And so that went to, and like, for example, I said we gave our money to California because California was able to generate $29 extra million from what we call reallotment because they were able to draw down additional federal funds.
Darren.
So is it safe to say, the other states got baby places like y'all? Y'all the only one in Louisiana that support, like CRC is y'all the only one able to support, you say the people?
So in each state, you have at least one, if not two, vocational
So
rehabilitation agencies.
y'all the only one, correct?
Correct. We're the only public vocational rehabilitation program. Correct.
Okay. So if we had two, they can draw it down.
Right, but the only time states have two is when they have a separate blind agency or some. We used to have a separate blind agency, but the majority of VR agencies combined. We're called, and when I go to national places, we're called Louisiana Combined.
Okay.
Because we don't have a general agency and a blind agency, we have a combined agency.
Oh.
So I have a blind services executive director, but we technically are only one agency.
Oh, okay.
So they don't get extra money, their money is just split a little bit differently.
Gotcha.
Melissa, I was just wondering, since y'all have been shorthanded for so long, are they in the process of allowing y'all to go ahead and hire more people to help with the shortages and?
So part of the challenge with my hiring is getting applicants. That has gotten better in the recently. But also I did just get approval to hire 10 job appointments. So in the state government world, like you have, we call TO, which is your table of organizations. So there are a certain amount of funded positions that you have, and you can't go over that amount. So in order to hire more people than what your TO is, you can hire what's called job appointments. But job appointments, they can only go up to 4 years. And then either you have to find a funded position for them, or then you have to separate them.
Any other questions?
Rosalind.
Ms. Rosalind?
Yeah, the way you said with the funds and that, if they don't use it and that, and what would happen with the funds that y'all use if you're not using it on to be placed in the job and that
So,
for any department?
so all the funds that we're able to draw down, we do use to support individuals with disabilities. The funds that we're not able to draw down goes to other states.
So what happens with that kind of money if the state don't use it?
I don't know because we use all the funds that we're able to secure, we do use.
Mm. Is that like for schools, or is that gonna be for like use for jobs in specifically?
Okay, so when we receive funds for vocational rehabilitation, we can use those funds for any of the services that are in the federal regulations. So that could be anything from training to job placement, supported employment, assistive technology, home modifications, vehicle modifications. It just the whole gamut of what we're able to provide in vocational rehabilitation.
Well, that's what I was thinking, but I wasn't sure.
Okay,
That's what made me ask the
okay,
question to prepare for what I was thinking
okay.
on that kind of page.
Thank you. Tony?
You have to unmute Tony.
Hope you can still hear me.
Yes,
How rare is this when this happens yearly?
how, for Louisiana,
Yes.
we have not been able to match our funds since I think 2008. So we've set back funds since I believe 2008.
And since of that 08 until now, has it somewhat changed maybe?
For the last, I'd say 8 years, we've been receiving approximately the same amount of state funds, which is about 8 million we get through direct appropriation.
I see.
Yes.
Now I'm just putting myself, if I did that and you wanted me to come in or something or whatever that progression might be, could that be a possibility for me per se?
You're saying if you need services? I'm sorry, I'm not understanding.
No, not so much services, but one-on-one trainings per se, that way.
So trainings I'm not quite understanding. You're talking about getting training or training
Yes.
on? Okay, yeah,
To get trainings. Or
yes, we provide training, yes, sir.
Okay. And how often would that be possibly?
Are you talking about training in vocational rehabilitation or training for a job? Okay, so we
Training for a job.
training for a job. I mean, so when you come into the vocational rehabilitation program, we develop what's called your individualized plan for employment. And that's, you would discuss with your rehabilitation counselor what kind of training you need, and then that would be on your plan. And it would last until however long it takes for you to get the training that you need for work.
And I see 16 to 21 of age, right?
That's just for pre-employment transition services. So vocational rehabilitation is for if you are eligible to work, or if you're able to work, then you can be eligible for the VR program.
Okay.
Yep.
Any other public comments?
Ms. Rosalind has a hearing.
Rosalind?
Yeah, if, like he was saying, I was going to, kind of answer his kind of question on it. If I'm not correct, because I went through it, you have like 90 days to be coached in the field that I chose, and that to Ollie to keep the job, if I'm not correct on that. With the services from y'all, from the LRS,
Yeah,
if I'm not correct.
Yeah, job coaching is one of the services that we do provide. That is correct, Rosalind.
Oh, because I was going to, use myself for that because I went through LRS in that, and that's what I kind of did. I went through 90 days to do what I am doing now.
Okay, good.
And before I go, Miss Rosalind, when we see you, you're like upside down.
Well, For me, I did succeed, and my thanks goes to LRS, actually.
Thank
Because
you.
I wouldn't be here, and I succeeded in my job at Cafe La Ciudad for 2 years. So my thanks goes to LRS.
That's awesome. Thank you, Rosalind.
Hearing no other comments, the report requires no action and will be placed on file. The next item of business is the report of the Office of Aging and Adult Services. The chair recognizes Mr. Gary Williams to present the report.
Good afternoon, everyone. Again, Gary Williams with Aging and Adult Services. Just want to hit on some high points, of course, at the very top, one of the current recipients of services. When we talk about to the right there, the Community Choices Waiver, and looking at the registry and how many are on the wait list, CCW registry without ACBS services, 4,839. And on the registry is a total of 5,886. As it relates to the wait times, the CCW wait time of 13 years, those that have that longer period or longer wait time of 13 years, those participants are receiving services. However, they are receiving the long-term personal care services, and in some cases, it's a combination of anywhere from the long-term personal care services or the adult day health care services are being provided. Others that are on the list and not receiving any services, that's where we see the average of 46 weeks. Of course, this is related to staffing issues, could be staffing issues with direct support workers, as well as the support coordinating agencies. With traumatic head and spinal cord injury program, we have 271 on the wait list. It's due to funding being available. That program provides for a $50,000 lifetime amount and up to $15,000 per year, with a total max of $50,000, as I mentioned. I'd like to highlight the Adult Protective Services. We continue to see pretty large caseloads within Adult Protective Services for abuse and neglect cases. We anticipate that increasing even further because we are in the process of doing a public awareness campaign. We found that a lot of citizens don't know how to report abuse and neglect. They really don't know what abuse and neglect looks like. Abuse, neglect, financial exploitation, all of that is going to be a part of a public awareness campaign, and we'll have billboards, brochures, probably some radio spots as well, and some information on social media to advise the public of what exploitation and abuse and neglect looks like. So we, of course, consider the number of staff that we have, and again, anticipating a spike in the number of claims that will be filed related to abuse and neglect. So additional investigators, that is a part of our budget request for fiscal year 26. As it relates to the cases for FY 24, as you see, the large amount of them are caregiver neglect. And then of those cases, 40%, almost 41% of those have been substantiated. Self-neglect is also a part of that. When we looked at the OES population and total program participants, you may note a little difference between the bar graph and the population by region. The population by region, the state map there, those numbers are off just a little bit because there are some difference due to some errors in zip codes. Of course, as an agency, we are aware of the nationwide labor and workforce difficulties, the shortages that I just kind of mentioned. So we are using some of the American Rescue Plan Act funds to hopefully make a difference in that area. We've in 2023, there were some bonus payments as outlined here that were made to some direct support workers and support coordinators. Of the bonus payments, we made sure that the bulk of that went to the direct service workers. And this year we are doing a gap analysis that we're in the midst of, and to look at areas related to workforce and how can we attract more folks to the workforce to provide direct services to participants, as well as we looked at different areas of the state that lacked coverage for support coordinating agencies. In 24-25, we'll be offering some trainings as outlined here, in hopes that providing that additional training that will not only help with attracting additional staff for these agencies, but giving them the training that they need to be more effective as it relates to providing services to participants. That's all I have.
Thank you, Mr. Williams. Are there any questions from council members on the report? Lauren?
Under caregiver neglect, do we know how many of the caregiver is like, family or in-house caregiver versus,
Not
Family, I don't have a breakdown of that. I can get
okay, I didn't know if y'all even take that metric.
Yeah,
I
I
was
can
just
find
wondering,
out. I'm
because
not
sometimes
sure.
that comes up,
Yes, I'm not
especially
sure.
at town hall meetings and stuff.
I'll
you know,
find out if that is the difference between if it's family or other.
Right.
I can
And
find
then, if one good thing, like, cause I work with the community, I know y'all are doing brochures, but if y'all do just something that I could print out, like a PDF fact sheet, just to hand out, or like we have information at the front. It doesn't have to be anything fancy, but just, maybe with your big statistics, this is the website process, easy to read. Or for somebody in mind who may be concerned that they are being, neglected or abused, and they grab it. Something.
Okay.
Thank you.
Sarah?
I see you spoke about youth and neglect and you say y'all trying to work on that, and I see y'all got pretty high numbers on that. Well, the thing is with the abuse and neglect is, a lot of people are scared. They can't get away from whoever's doing. You understand what I'm saying? To report it. And some of them can't read to get to where they need to get to, what they need to get to even report.
I agree. And hopefully by virtue of doing this public awareness campaign, sometimes it could be a neighbor. Sometimes it could be someone else that's visiting the home. So we're in hopes of, by doing this public awareness campaign, we can help people understand what abuse, neglect, financial exploitation looks like. So even if it's not the participant that's making the claim, it could be another family member, it could be a neighbor, it could be someone that's a delivery person. So that's the reason for the public awareness campaign, is to help others have an idea of what abuse and neglect looks like, and it will identify different ways that can be reported.
Because a lot of them try to put it out there on a slick way and then, throw signs and if you don't catch it, they still wrapped up around that person. Or they could be in a home with a family and some of the workers is scared to report it because their hands is tied. If you see anything going on in the family, you're just not supposed to tell. Only thing is you're supposed to do your job. So it's a win-win situation. It's a losing situation. All they're supposed to do is write it down, and do their job.
Yeah, hopefully we'll have several different ways for those to be reported.
Any other comments? Oh, yes.
I just wanted to know, is there an option for, say, someone from the community to make a report anonymously? Or do you have to disclose who's making the report? Like if it was a worker that was fearing losing their job or that type of thing?
I'll find out for sure. I'm quite sure, almost positive it can be done anonymously, but I'll find out. I'll make sure.
Sheree?
I was a little bit surprised when I brought my daughter to Children's Hospital to see a neurologist. During the triage process, they asked her, you know, if she was scared or if she was being abused at home and I thought to myself, like, even if she was, she's not going to say it because I'm standing right here. So maybe if there's an opportunity for physicians, you know, while they're meeting with the patients, while the caregivers or family members can maybe step out to ask, you know, so they don't feel threatened. I mean, maybe that might be a good place is when they're receiving healthcare through their dentist or through their physician or whoever. Again, I was surprised that they would ask that question in front of me because I mean, she said yes because she wanted to, you know, see me, you know, laugh at her, but, you know, but it makes me sad for the kids that actually are in a bad situation because they're not going to say that in front of their mom or their dad or whoever is abusing them. So maybe educating providers, physicians, dentists, whoever could have that one-on-one with patients.
Any other comments, Lauren?
I have a question too, and I don't even know if there's a way to resolve this or anything, but I know with children, if they're in a abuse or neglect, there's foster system. If it's an adult or an adult with a disability, we take them out of that situation.
Then what happens?
Where do they go?
Right.
So maybe even like,
Yeah, but
Yeah.
we as a standard, even in cases of, as it stands now with cases of abuse or neglect, if it's a child, then we get other agencies involved, such as the Department of Children and Family Services.
okay, so for adults too, you'll have to have like a backup plan or,
Yes,
okay, and maybe putting that in there, that way, you know, if you report it, you're not stuck in that situation.
what avenues they have to address it.
Yeah.
Okay.
But there's a solution, you know.
Any other public comments? All right. Hearing none, the report requires no action to be placed on file. The next item of business is the report from the Office of Citizens with Developmental Disabilities. The chair recognizes Julie Hagan for the report.
Hi, this is our report, the longest, the book in the book in there. So I won't read it to you guys. It's really got lots of data points that the council's asked for in the past, followed by some updates. So I'll really just point out a couple of highlights. And Angela mentioned it, but did just want to make sure everybody was aware we are doing a road show throughout. We've been to Monroe, Shreveport, and New Orleans, but we still have 6 more road shows left. We'll also have a virtual option where we're providing more information and some about what we've been working on the last year, what we have coming up in the upcoming year. For folks who need it translated, we'll record the virtual option with closed captionings that'll go on the website so that folks will be able to have those closed captionings translated if they need that. And I can't remember exactly when that virtual roadshow is, but it's on our website. And I believe the council did also share the flyer of when those dates are, including our virtual roadshows. Also mentioned the rate study. I did just want to share a little bit more. The flyer went out for that as well. But we do have 2 rate studies going on. One rate study will look at people receiving services in the intermediate care facilities, the other through home and community-based waiver services. In both instances, both provider networks as well as people with disabilities who use those services and their families will be invited to attend and participate in some focus group sessions that we have to make sure that we're considering all the things that we need to that go into it. We have contracted that out with 2 vendors who have experience in other states with rate setting. And so we hope to have that completed by June or July, so that we then have some objective information around the rates and the considerations, all considerations that need to go into the rate. So do encourage folks to listen in if that's something that's of interest to you. Another thing that we're working on that I hope to kick off in January, and I don't know exactly what it will look like, but have heard from a lot of people who are self-advocates that our office needs to figure out a way to hear from them in more of a safe space. That sometimes, and you guys do an awesome job, but sometimes self-advocates say, if there's family members and providers and a whole bunch of state staff, it's not always a safe space. And I think, Eric, you've mentioned that safe space in here before. So we're going to be putting together, it'll be virtual, but it'll be an opportunity for us to hear from self-advocates around our developmental disability system. And we're looking to kick that off in January. So if you are a self-advocate and are interested, please do shoot me an email. And if I don't hear from you, I might reach out to you anyway to say, hey, do you want to be a part of? But we hope to start kicking those off in January. And again, I really think I want to talk with that group about what they think it should look like without going in with some real specific ideas about where we want to go with that. We did also just share, and this is in our roadshow, but I've talked to you guys a lot about the National Center for START Services that does work with folks, does a lot of studies with folks with intellectual and developmental disabilities and serious mental illness. We did get their report. We did a quick one pager that we sent, so I imagine DD Council can be sending that out shortly. I think the report itself is about 50 pages, but there's a lot of really interesting information in there about what they found from doing surveys and talking with folks. We talked with a lot of people that are on the council. We talked with Meredith and some of her staff at Department of Ed. We did talk with some of the folks at Children's Hospital, we just mentioned. They talked with some of the police force and also sent some surveys out. So it's a nice, it's a nice kind of view of what that gap analysis, I guess, did. And then there are some recommendations. So our next steps will be looking at how we partner and how we continue to work with them on some of the recommendations they have. Also, we've been doing a lot of work. A lot of you may be familiar with our OCDD resource centers. They've been partnering with some other state agencies as well as the Administration on Community Living and NASDs. And there's now a website, it's fairly new, it's called the Link Center. And there are all kinds of resources there that are available on the Link Center. There's trainings, there's informational material, all of it for people with IDD and behavioral health concerns. We've actually got some things on there from Louisiana. We did a lot of work around wellness. And so, you know, there's a lot of research out there that the things that we used to call, quote, behaviors, or so they're having this behavior or that behavior. It's really not a behavior. It's that they're bored or they're not really having a great life. And so let's quit talking about behaviors and let's talk more about wellness for all of us and how you help people have a good life. And so there's some different training materials that they've done. We also worked in conjunction with the ARC of Louisiana to develop sort of a clinician guide. And that clinician's guide for supporting people with IDD and serious mental illness can be found on the ARC of Louisiana's website as well. And again, that's not geared for like our direct support professionals, but more if you are a psychologist or a doctor and supporting people with intellectual and developmental disabilities in your practice, what are some considerations or things you might need to have? So those materials are all out as well. I think those are my highlights, but I don't know if there's other, we talked a lot about things from the Self-Determination Committee, so I don't think there's other questions. I'm happy to take them.
Thank you, Julie. Any other questions from council members? Is there any public comment? Hearing none, the report requires no action and will be placed on file. The next item of business is the report of the Office of Public Health. The chair recognizes Ms. Patty Baravecchio for her report.
Thank you. So the Bureau of Family Health administers the Title V program for the state, and that's what funds our children and youth with special health care needs programs. So this year or this quarter, I asked the Title V block grant team to just give you a little snippet of what goes into the block grant. And because that is really the source of all of these different programs that are funded. So in our report, you'll find about, we have still some direct services provided for subspecialty pediatric clinics in parts of the state where these are needed. We also have a safety net transportation assistance program. Oftentimes, sometimes there's issues with families utilizing Medicaid transportation. And so they have to apply first through Medicaid. And then if they have a denial or reason why it is not appropriate, for instance, if a family is traveling with the child that's the patient and a sibling, you know, that may not work with Medicaid transportation, but there is a transportation program, and that's what the stipends are. They provide support for families needing help with special need transportation. We also have a family resource center that supports all families that touch the Bureau of Family Health programs. And through this, the Bureau also does the Louisiana Birth Defects Monitoring Network surveillance, and we reach out to all families to offer them access to resource and referral services and ensure that children that have been identified with birth defects are linked to the services and supports they need. We also work very closely with our Families Helping Families project. Right now we're coming into our provider education series. There's one on October 29th, addressing the behavioral health needs of children and youth with special health care needs. You can find more information about that on the Region 3, 5, and 8 websites, Families Helping Families. So that's coming up at the end of this month. We do the early hearing detection and intervention program, which also has a parent support component, which is our Hands and Voices. So if you know anyone who could utilize the peer support for children who are deaf or hard of hearing, that might be a service that they might want to participate in. And then we administer the state genetic screening program, and with the Louisiana Commission for the Deaf and our adolescent school health program. So a lot of little snippets about the different programs that are under the Bureau of Family Health that work to support children and youth with special health care needs.
Thank you, Patty. Are there any questions from council members on her report? Tony?
Yes, who was that? That just talked with us?
Dr. Baravecchio?
The one before.
Ms. Julie Hagan?
Yes. She was talking about having self-advocates to help her.
Yes.
I would like to be one of those.
Okay.
Any other?
To help her.
Oh, Jill?
Why don't
Yes.
people know names on this committee? I don't.
The one that just talked. I'm sorry.
What,
Ms. Baravecchio? Patty?
okay, number one.
It was her.
I mean, what's your question? I'm sorry. Got it. Oh, okay.
She mentioned needing advocates to help her.
Yes, she has it. She has you down, Tony.
Okay.
Right, any other?
Thanks.
Rosalind has her hand.
Okay. I'll answer some question in my head. All right. I'll go.
Well, when if you could stroll up where you had it before, because it's with the BFH was,
Is that it, Rosalind?
The
huh?
Family Resource Center?
Yeah. That's
Yeah.
where my question was,
Okay.
because, what it was that for that question, how many families are in that center that you have? And that,
It's a virtual resource center, so families call us or we do outreach to families that are identified with a child with a birth defect, but
I
families.
don't think it was this one, but if you,
Yeah,
you
okay.
know, go up a little bit, I mean, wait a minute. No, it was with a B. It was like a B, it had like a parentheses around it with the BFH was with the parentheses. You know what I'm talking about?
Of the resource center?
Yeah, that's the one.
So
Then
you
you go
can
up a little bit.
Yeah.
BFH Family Resource Center.
Is that one with the parentheses around it?
Yeah, that's the email address. If you need assistance on looking for resources, you can email that email address and resource specialist will contact you.
Oh, okay. Because how many did attack y'all on that one with the families and everything?
Oh, from July to September, the total number of families engaged were 316.
Mhm. Yeah, because I seen for something with that. I couldn't glance at it because you strolled it up in that with it.
So
That's why it was in the with the parentheses.
The total number of families engaged are 326, and through those encounters, there were over 660 needs identified. So meaning that some families had more than one need.
So how many needs are in that count that you have?
660 needs were met during the last quarter.
Oh, okay. So what is this one with the 660 one?
That's the total resource need identified and addressed.
Oh, okay. That's what caught my eye in that. You know, that's what made me ask. Even with the network that the families need. That's not what you. Is that with the blind people in it?
Anyone can contact the Family Resource Center for any need, but they can be part of the community that reaches out to the Family Resource Center.
Oh, okay. That was my question. Where it is.
Any other questions? Thank you.
Yeah.
Any other public comments?
No, ma'am.
Right, yes, sir.
I'm Jim Sprinkle. We have the Family Self and Family in Region 6. We've heard Ms. Patty about this. We have the contract dealing with this transportation assistance program. And I'm kind of greatly disturbed because over the past 2 or 3 years, you see the amount of money that was spent in that first quarter. We have like $60,000 and we never spent anything. And I'm trying to figure out how to publicize it. But the money's there. If anybody has any ideas, right? They do have to qualify.
Yeah, they need eligibility, yeah.
We need help with food, transportation, hotel rooms. But the money's there.
Thank you. All right, any other, Julie?
Just a comment, if it would be helpful for us to get that information and share it, say with local governing entities and our sport coordination agencies, we'd be happy to do that. There's a flyer or something.
Yeah, there's a flyer, I believe, online. I'll get over to you.
Okay, thank you. Anybody else? All right, thank you, ma'am. Hearing none, no other comments, the report requires no action to be placed on file. The next item of business is Bureau of Health Services Financing Medicaid. The chair recognizes Brian Bennett for the report.
Hey, good afternoon, everyone. I'm going to be giving Medicaid's update. So if you turn to the second page in the news and updates section, I'm going to review a few things. So first, one of the big things that we're trying to promote with our Medicaid members right now is the open enrollment period. Medicaid's annual open enrollment period began this week on October the 15th and will close December the 2nd. During this period, there's an opportunity every year for Medicaid members, if they would like to change their Healthy Louisiana MCO plan or their dental plan. Letters were sent out to members back in August that included information on how to change if they wanted to, or how to get where to locate additional information about plans if they wanted to research that. If a member is happy with their current plan or plans, they don't need to do anything. If they don't do anything, they'll just maintain their plans that they have. They only need to take action if they're interested in switching their plans. And if they do make a switch, their new plans will go into effect on January the 1st. The website that's in the report, I think it's at the end of the second paragraph. It's the myplan.healthy.la.gov site. That's a website to go to. It's a good resource for anybody wanting more information on the various health plans or dental plans. On that site, there's a comparison chart, which gives information on additional services that each plan offers. So aside from your Medicaid benefits, each plan offers a few extra services to members. So people can go and kind of compare those. And then also they can, on that site, search for their provider. So if you're interested or if you're considering switching plans, you can search for your doctor or any other provider that you're currently using to make sure that they're contracted with that other plan before you switch, if that's important to you. On the next page, regarding the website, and I think I might have touched on this in my last update, but the LDH website, including all of the Medicaid content, we are in the process of redesigning that, and the new website is scheduled to launch next month in November. I believe it's sometime in the middle of the month. So I just wanted to let everybody know about that. When that launches, it will look a little bit different, and hopefully the new design will make it easier to find content and easier to navigate. That's the goal of the redesign. Every couple of years, we take a look at all of the content and try to clean it up, redesign it, and make it more user-friendly. So next month when we launch that, there will be, the website will just look differently, and it'll be more oriented for the public or the visitor on how to find information and resources. And then to wrap up the news and updates, I'll review two big initiatives that Medicaid has been working on in partnership with other LDH agencies. The first one is the Transforming Maternal Mental Health Grant, or you might hear it referred to as the TMA grant. This is a competitive grant, and the Centers for Medicare and Medicaid Services, or CMS, will award grants up to 15 states. So the department, LDH, submitted a grant application, and if selected, this will provide Louisiana with funding over the next 10 years to focus on initiatives to improve maternal health outcomes, while also addressing physical, mental health, and social needs of the mother. And we hope to have a decision on whether or not we're selected by the end of the calendar year. And at the end of that, I included the website. So if anybody's interested in getting more information or staying up to date on that program, I've linked the website at the bottom. And another big project that we're working on is a demonstration waiver to provide Medicaid coverage to incarcerated individuals up to 90 days prior to their release. And we're calling this our reentry demonstration waiver. And the primary intent of this is to improve the continuity of healthcare and care transitions. And for those that are transitioning back into the community, to get them established with services before they get out. So Medicaid is working with the Office of Behavioral Health and the Department of Corrections on this program. And we submitted our application for this program to CMS on September the 27th. So this is something we've been working on for the past few months, and we were very excited to get this submitted. There are several other states that have programs similar to this that are already approved, and probably another 10 to 15 states that are kind of in the same situation as Louisiana. They've submitted applications and they're working with CMS to get those approved. We are currently in the federal comment period right now, and that goes into next month, into November. So again, if anybody would like more information on this program, just like the TEMA grant, I've included the website that you can go to get more information on that program. So the second half of the report, the program and services section, it contains a brief overview and snapshots of a few of our programs and services. Generally, what it includes is the number of individuals served or enrolled for each of these programs, and or the number that are participating and receiving services. I won't go through all of these, but I'll highlight the Act 421 program, or the TEFRA program. That starts on the bottom of page 5. So that program launched at the beginning of 2022. So we've almost had that program in place for 3 years. Since the launch of that program, we've approved and enrolled more than 2,600 children, and there are currently more than 2,100 enrolled as of today. As of yesterday, I checked yesterday for an updated count. But specific to the Act 421 program, one thing that we're doing right now, we're working with OCDD and Medicaid eligibility staff to take a look at the application and renewal process for this program. Now that it's been in place for a few years, we're really looking at the various steps to see if there are any opportunities for improvements, any systems or process enhancements that we can make that are ultimately aimed at making the application or the renewal process smoother and faster for families. So we're going to continue to work on that over the next few months to see if we can improve that process for TEFRA or Act 421. So I think that concludes my report, but I did want to mention, I've been looking at this report over the past few quarters and making some tweaks and changes here and there. But if there's any particular information that the council would like to see in the report, please let me know. And I'll check to see if we can get that incorporated into one of our future reports.
Thank you, Brian. Are there any other questions, Mr. Eric?
I have a question with you, do y'all send, people out to talk about your medical, a better medical plan for you? And do y'all have people to call about your medical plan and change it and tweak it and make it, y'all just random do that?
Mr. Eric, are you talking about what I covered at the very beginning about the enrollment period, about if you'd like to switch your plan? Getting more
Something like that.
information on that?
Yeah, do y'all just random, they, give the information for somebody just to call and, make a permit to come out in your home?
I'm not sure if they do home visits, but at the end of that second paragraph, there are a few resources. There's a 1-800 number that you can call. That goes to our enrollment broker, where they have people that can review the various plans with you and give you information and answer questions if you have any.
Thank you for that, but what I have somebody call me and say where I can come out at this time to sit down and talk to you about your Medicaid plan and tweak your plan and all this. And I was wondering, do y'all do that? Because the complex I stay in is nothing but elderly people, and if you got people just randomly calling you and setting appointments, that's an open door just to get people.
Yeah, I'll check on that. I'm not aware that they do that, but I could be wrong. So I'll check on that for you, and I can follow up with that information. If they do in-home visits for that.
They do that? Because I'm very concerned about that, because the complex that I stay in, some of these elderly people just be like, oh, come in and let me sit down and talk to you. And that's an open door for the information to get out.
Yeah. I'll check on that. I'm not aware that they're going and doing home visits, but like I said, I'll follow up to make sure for you, Mr. Eric.
I mean, can you do that? And and send it back to the board, and they can send, because that's a concern I need to know. So if they rolling around the property and doing that, that needs to be reported.
Yes, I will send that back and share it with everybody. Share what I find out.
Thank you, sir.
Lauren?
There's a program called SHIP. It's an advocacy service, Senior Health Insurance Information Program, that's not affiliated with any Medicare. But they will go through a plan with me and do all that services and set up those appointments. I don't know if there is one specifically for Medicaid. That was going to be my question. And if not, in the future, if y'all could maybe look into having trainings for people with intellectual disabilities or parents that are in open enrollment, to where they can compare the plans and things like that, and have a similar program, because our needs or needs of children are different than the elderly, and we're often all conglomerated into one.
I think so.
So that might be something in the future. And you said y'all were redoing the website. Do you know if the website's accessible?
So it should have all the current functionalities that the LDH website has now.
Okay.
It should be, oh gosh, is it 508 compliant? So is there a particular something that you're wondering about, Lauren, or?
No, I just wanted to make sure that
It should be, that was definitely, something that they worked at, when they were building this with the vendor, so it should be, but, once it launches, if there's something that's not available or missing, we can definitely look into that to get it active.
Thank you. Eric, I'm sorry, asking.
My concern is, if it's being done, it needs to be on black and white on paper, so we'll know, so we could better understand, okay, this is what's going on, so no back door won't be open. Anybody should then say, okay, this is this and this is what's going on, we need to know this, so no back door won't be open, where they getting out their personal information.
This is something, you wanna know if they're going to home visits so they don't steal
Yeah.
information, okay?
That's my concern.
Yes. And I have a question, Brian. In regards to the dental plans, we have children that, it takes them a long time, especially if they have to be put to sleep, like sometimes a year or more, to get, to be seen from a dentist. So how do parents, especially if it's something severe, how do they go about and expedite that process?
I'm gonna have to check on that. I'm not sure. I'll have to check on that. I do know that they do have, especially in some areas, shortages with dental providers.
Yes.
That's been something that they've struggled with for a while now, but separate and apart from that, I will check to see if there's a process for submitting a request to expedite a certain procedure or service.
Okay, thank you. Are there any other questions?
I have one.
Yes.
I just wanted to maybe for next time you asked, what could be added. So I would like to see clarification or the criteria for, in some of the special programs in Medicaid for a person that is over 19, which overlaps with neglect and abuse. If it could be clear of who is approved, not approved, and does it include behavioral and also their dental care? If the payee, so for example, the payee who's using Magellan, United.
So was the question kind of just providing clarification, or providing clarification for when a child ages out of their children's Medicaid benefits, kind of like what are the differences when they go into the adult Medicaid benefit program?
Correct.
Okay.
Or if it was a special qualification in which a family before abuse was put onto Medicaid. There's not clear criteria, and it's very challenging when trying to find providers.
Okay.
So if it could just be really clear who can and who cannot, be a provider, and that's for everything. Well, primarily the behavioral and dental.
So what was, I'm sorry, what was the second part related to the providers?
So I think someone touched on that, a lack of providers or special circumstances. It's a, the length of time, especially for behavioral, sometimes, if you have a crisis situation and there's over a year waiting for the assistance or support to begin. So by then you have a blazing fire, and the same applies for dental. And that overlaps with, so I don't know where the gap would be from this council. Neglect. So it could involve dental. There again, you're waiting many, many years, and then what is available
is not what patients need. I can be really specific in a private email if that helps.
If you wouldn't mind, if you want to, you can email me and maybe we could set up some time to talk about that, just so that I can make sure I get everything or address everything that you're looking for.
Thank you.
Okay.
Public comments? What was that?
We have Ms. Kathy Dwyer. She had her name right first.
Ms. Kathy?
Over there.
Thank you. Regarding, I don't know who asked a question about if Medicaid is the additional time adults with disabilities need at the dentist. I'm the co-chair of the Louisiana Dental Task Force for Adults with Developmental Disabilities, and was along with the task force helped with getting Act 450 passed. That provides comprehensive dental care for adults with developmental disabilities who are waiver recipients. There is a code D9997 that allows dentists to bill for extra time, including up to 4 visits a year. I can email that to anyone that may need it.
All right, thank you.
Thank you for that, Kathy.
Oh, Jill?
Miss Kathy, can you email me that? Because I think I go to the dentist for, well, I don't think I go to the dentist 4 times a year, but I think, and I'm probably wrong, I think twice a year I'm paid out of pocket, but I don't give them my credit card, so I don't know.
Is that Jill speaking?
Yes.
Yeah, Jill, if the dentist feels you need more visits than the 2, that's what this code would pay for, additional visits. So let's say you need extensive work more than a general checkup and cleaning, and maybe just a filling here and there. It allows for 4 visits a year as opposed to just 1 or 2.
Thank you.
You're welcome.
Any other public comments?
We have Ms. Melinda.
Miss Melinda?
It wouldn't let me unmute. Can you hear me now?
Yes.
Okay. Mr. Bennett, you're from Medicaid, right?
Yes.
Okay. So Domino, my daughter, has a waiver and has Medicaid. I want to share how much of a mess Medicaid is. I have talked to Medicaid on and off since June. I got everything finally seemed to be settled in August because I had to go through some kind of determination twice, once because of her Medicaid and once because of her SSI or something. And anyway, so August 24th, talk to people at Medicaid and they tell me everything's fine. It's all hunky-dory. They don't need anything else from me. Apparently, there was a letter sent that I didn't get August 28th telling me that they needed more stuff. I didn't find out about it until somebody emailed the case manager. It might have been MCAL, Human Service Authority. and told her that I couldn't use any more waiver hours because my daughter's Medicaid had ended. So I have worked it out. That's not the problem. The letter that MCAL got was based on information that everything was going to end November 1st, which should have given me to October 31st, but they didn't have that letter at the time. Now they have that letter. Now I'm using the hours. I'm busy getting them the pay stubs. I sent it last Friday, so I'm not positive I'm good, but I think I'm good. But again, this is 3 different times that everything was supposed to be good since over the summer. And 3 different times that I suddenly get a letter from somebody or calls from somebody saying, nope, it's not good. You have to contact Medicaid again. And I know what I'm doing. I'm a seasoned advocate. I've been doing this for 30 years, I think. And this is a mess. And you get to hear about it because you're the person that's here. Thank you.
Thank you, Brian. Any other questions? Hearing none, the report requires no action to be placed on file. The next item of business is the report of the Department of Education. The chair recognizes Meredith Jordan for a report.
Thank you. So I've heard a theme as we talk today about roadshows and going out into our communities and to our stakeholders and to the people that we provide service for. And so that's certainly also something that many of you know my team is doing right now. I think right now there's no one on my team sitting behind computer to desk today. And I think that is so important as we think about purpose and the children that we serve and their families that we serve, and something that's super important to me. So that's been really interesting today to hear about all of the agencies and all of us and the work that we are going out and the support that we're trying to provide all of our children and our families. Just provide you guys really quickly. My first update is a SEEP one, shows you our upcoming dates. We recently met in September. We had a host of topics on our agenda that we worked with SEEP with on updating our parent handbook that will roll out in the coming winter months. We've had a lot of legislative and resulting policy shift that requires us to also update our parent procedures and safeguards manual that goes out at least annually during every IEP meeting. There are also certain circumstances where you give that out even more often to parents. So you'll see that update come out, and I've taken a lot of the feedback that I hear here from stakeholders, of course, from our SEEP in terms of how to make that really parent friendly. And to make sure that the resources, supports, contact information from helpful resources are in the forefront on those documents. We also released our 2023-2024 local SEEK report. This year we collected more than we ever have. So you can see that it's posted publicly. We shared it at our last SEEK meeting. We also addressed and they endorsed revisions to Bulletin 1530 regarding alternate assessment participation criteria, which will go to Bessie in December. And so just a little bit about the work that SEEP has and continues to do. I think we have updated and addressed more policy in the past couple of years than has ever been addressed. And we seem to be moving quickly, which I like, because I want things to happen and change quickly and for the better for our children and for our families. So I'm really proud of the work that they're doing and the work that they'll continue to do. So our next meeting is November the 12th.
So coming up pretty quickly. Again, I linked for you that annual report in that next section, as well. And we've already, updated both policy, and guidance around the new legislatively required and now state policy required, reporting components within those local SEEK reports. So, our LEAs have to add three specific, reporting components in there. So they have to report on their IDA funding and spending in their local agency in the school district. They have to report on any compliance issues that we have issued to that LEA within that report to their local stakeholders. And there's one more that I'm going to forget, but I have it written. Financial information. Yes, no, I said that. Finance. It's academic performance. So they have to also report on the academic performance. How is that subgroup for their students with disabilities performing in their LEA? So we have already, I think I worked with SEEP about a year ago, and we created and provided a reporting template to districts. That is not required by law, but something that we thought would be helpful for LEAs to have something to go from. What would our stakeholders want to see in these reports in terms of what you're doing and what their local special education councils are meeting on. And so we've already updated that template and shared that well in advance this year to special education supervisors. So they know about that change and what those additional reporting components are. This next piece, I wanted to share, this work is led by our early childhood office. We have a coordinator in that office that my team works very closely with, who leads our young children with disabilities work. We secured, that team secured a professional development grant to do some young children with disabilities work around early identification and making sure that across our state we're using the same developmental screener. And our agency is providing a lot of professional development and support around that screener so that we're being consistent and that we are identifying students early and accurately. I say those things together because they're both important. So that we get students those early intervening services as young as possible, so that they can be successful and they get those interventions starting at a very young age when we know that that they need them. So I wanted to share that work. If you have very specific detailed questions, I may have to bring those back to you, but wanted to share that work with you because I think it's important. Our high call service initiative is one that we are moving right now. This is, of course, an annual initiative that we provide funds, additional funds to support our school systems and schools that serve our students with some of the most significant needs. And it funds those real high cost education services, interpreters for students who are deaf, for example, very expensive medical devices or assisted technologies, equipments that students may need, one-on-one assistance. It can fund salaries for individualized supports for students, as long as those things are documented within their IEP. And so this is an initiative that we run annually. We have more than half of our LEAs apply for this fund. They have to submit a lot of documentation to us. We have to do a lot of verifying and looking at IEPs to verify those expenses and those requests for those high service costs. There is a portion of this that is also funded through our minimum foundation program. And the idea here is that the LEA is responsible for certain costs, as they should, to support these students. And then the state can then also add some additional funding and support there through this grant award. And we set aside about $4 million for this because we just know that for some of our students, it's much more costly to provide these services and to provide the supports that they need. So this application, we run 2 rounds. The first round opens this month, and of course, it's also based on counts and enrollment. because the student has, the money follows the student. So if by February 1, that student has changed to a different school, that money for that service, that piece of equipment, that assistive technology follows that student, right? And so, so we run an application now to capture any of those students enrolled on October 1st. And then we'll run another round on February 1. This also goes the other way. So if I'm in a school system and I received that student and maybe their previous school system did apply for some of those funds, that second round is to capture any new students that we may have missed or that LEAs may have missed across the state. So it's something that our LEAs really rely on, this additional funding from us to help them pay for some of these services. We work with the Accessible Educational Materials Center. We have 2 annual fall conferences that they're hosting with us this year. And this is all about providing professional development really anchored in those evidence-based practices, inclusive practices, and ensuring that our students who use AAC and communication devices, that their educators and the professionals have the capacity and the professional learning to know how to give our students their voice. And so this is something that always fills up. We actually have two, last year we did 1 location. This year, they're doing 2. What we are finding, and I think also the reason that we as a department go on these regional roadshows is because we find we have to go to our LEAs. We're just a really, I mean, we just cover so much, we cover mileage in our state. And so when we host everything in Baton Rouge, I always miss people from North Louisiana, you know, because it's, you know, 5-hour drive for some of them or more. And so we're trying to do these regional events where we can increase attendance and get out to folks. And so that's the reason we have 2 of these this year. We also just launched our SPED Fellows Academy. This is our 4th cohort, something that I'm really passionate about. I don't tell people no. We currently have 22 individuals who are in our 4th cohort. This networking and professional learning opportunity is intended to build capacity of our special education directors in our state. We cover law, we cover how to use the data. We collect a lot of data around these students. How do we make the best data-informed decisions to provide the best instructional opportunities for our students with disabilities in our schools? They are assigned a mentor. They also have to complete an executive learning project over the year where they are identifying a challenge or a need within their LEA that they are, as the special education leader, are expected to make a change on, right? And work with their stakeholders and their communities to address whatever that issue. So they have to pick some sort of challenge, something they want to address, a need within their LEA, and pitch that project to a panel of experts from across the state. And so it's a really rigorous year-long project. And we just launched this particular cohort. So we're really excited about this. I know we've talked a little bit yesterday and today and throughout our conversations about transition. And I got really excited earlier about some of the work that we were talking about with the Cape Youth Forum. So I won't talk a whole lot here. I know we've talked a lot about transition, but just we are moving forward with our DIV grant, with our activities, and bringing together. We've had a couple of meetings. Melissa's been there with quite a few stakeholders. I'm excited about some of these other opportunities and how we can really pull all of this together and make sure we have a successful framework in our state for supporting transition, supporting sort of that next day after school for our kids with disabilities. What do you need to be successful? What is the plan there? And so we're working with community independent living centers. I don't think that was something we talked about earlier, but you know, how do we support independence for our students once they leave, enter the workforce, or whether they're going to college? So this is a body of work that our team is really excited about.
And last but not least, I gave you guys, 2 additional supports, that's happening, for students right now, and is also available for our students with disabilities. We have our Steve Carter tutoring program, which the legislature expanded. It initially started as a literacy tutor voucher program for parents. That has been expanded to also address numeracy. So it can support tutoring for literacy and numeracy. I put the website there, to learn more about that. We also just began, and this is a result of Act 771 from the last legislative session. I'm in year 2 of Steve Carter tutoring. But last year, Act 771 now requires what we call high dose tutoring for eligible students in grades K through 5. So parents should be seeing, this is brand new. Our school systems had to submit an extensive plan to receive the additional funding to support this. I know this is happening. I've got the notifications for my own children who can benefit from this tutoring. And so school systems will choose from approved providers. It could be teachers within their school system. It could be retired teachers that they're using to provide this tutoring. And some of that is laid out within the legislation. It is to be school day embedded. It is should be some of our students with disabilities are the ones who need this additional support the most. We have gotten that question and are fielding questions about students with disabilities and high dose tutoring, and can I use certain minutes that are built into my IEP. This is in addition to that, right? Extra support for students means just that, extra support. And so again, K through 5 low performing students, they have to have scored below mastery on LEAP in either reading or math. They also, if they scored below level on their literacy screener or numeracy screener to start the year, all of those students are eligible for this high dose tutoring. It has been a heavy lift for our school systems. But if you look at some of the data, just 2 snapshots that I showed you, this is not all data that we collect on our kids. We collect a lot. But I believe that some of these additional supports that our legislature has worked on and that we are implementing are the reasons that we are seeing growth for our kids with disabilities. So I'm going to end by saying this. If you look at this data, I show the first one is our LEAP mastery in grades 3 through 8. And you'll see I have total population, and this is over several years, right? Total population, our regular ed population, and our students with disabilities. For the first time ever, and I shared this with Steve, and I think that we shared a press release about this, because this isn't happening across the country. For the first time ever, in a year where all students maintained their level of proficiency, and we knew it was going to get harder, right? We've been recovering learning loss from pandemic impacts. Last year, for all students, that level of mastery, we got to a maintenance level. They stayed the same, right? 37%. For the first year ever, our students with disabilities continue to grow in mastery in a year where all students maintained their learning. That is huge. We should be proud of the work that we're doing in our state. And I'm saying all of us, all of this work, the work on inclusion and inclusive practices that we've done. Am I satisfied at 13%? Absolutely not. I believe more of our kids can score mastery. And I know that's the highest level because I have really high expectations, right? When you look at our students with disabilities who are scoring, even at a basic, which is great for some of them, we see this same sort of incremental sort of growth. And again, I think that is grounds for celebration. And I think it is also a call to action for us, right? And we're not going to stop here.
So I just wanted to share that. And then you see the 3 through 8 in the high school also. And I put a little caveat here. We didn't have a social studies assessment. So I took the social studies out. So we were capturing apples to apples for all of those years. But when we add social studies back in, since 2021, it was 9%, 10%, 11, and then 12. So even for 3 through 8 in high school, we're seeing growth for our kids. And I think it's a lot of these additional opportunities, a focus on literacy, our inclusive practices focus as well. And again, you know, we have a lot more to go. We have a lot more work to do. And I just wanted to share this here because I think that there's this collective responsibility as well. And I think there's a lot of work happening in our communities that help this. So I'll stop there. We have national training on child passenger safety on school bus. That's really important for us. We don't talk about that enough. That's coming up as well. And I'll take any questions for discussion.
Okay, so first, mastery is not the highest you can score, advanced is.
Right.
And second, if you truly want to help identify and accommodate students in schools, you should help me amend Bulletin 1508 to where schools have to accept a doctor's diagnosis as true so that students can be identified and accommodated, because schools will reject a doctor's diagnosis or just plain out ignore it, and then the student won't get accommodated, and then it's not good.
We're working on 1508 right now. That's next on our policy to update. We've been working on it for a couple of months, so I appreciate that.
And just to let you know, my son was one of them who always scored. He's on the potential failure list every year because he has issues with writing and processing and putting things down on paper. But come leave time, he scores mastery. So I don't care what he makes on a report card. As a mom, as a, you know, and it's, as a teacher, it kills me to say that, but I know it's because he has trouble processing. He has trouble getting it out, and they want it all on, you know, that kind of stuff. But thankfully, his teachers work with him and give him the extra time, and he's able to make mastery and show that he's in honors classes now. He's in 9th grade, so he is progressing more and more, even though his grades don't actually show what he can, you know, provide his teachers. So.
Is he able to participate personally?
Mm-hmm. He's other health impaired.
It's helping him.
At the end of the day, he's so tired. Like it takes all he has. So I don't make homework. I can't. Yeah. He's ADHD and sensory, and it's just too much. Yeah. And I learned when he was little. I can't focus anymore. He doesn't have any more medication. Now his break. So he gets done when he gets done at school. And as a teacher, I know I should, but it's a fighting process. I try to, the lane that's the least for him, and that's one of them. If I can get him to do his work at school, yes, I'll take that in a heartbeat. Yeah. So, any other questions, Jill?
And with her.
That was after you, Jill. Go ahead.
Okay.
Thank you.
This came up a few months ago, but why do people with disabilities tear each other down so much? Like, why do people do that? Like, I didn't think me having a college or high school diploma was in question. Like, so why do people assume that everyone with a disability has a certificate of achievement?
Oh, you're gonna get on my soapbox. We should not be giving certificates of achievement anymore. We have too many opportunities. And I think what you just voiced, Jill, is like my mission. Because we can. And I believe that.
Wow.
because people just assume people have certificates of achievements and not high school diplomas from where Miss Patty Archbishop Chappelle High School look it up. Give me a picture of the school.
I think I'm gonna send you a picture of the school, Joe. Wait.
The Hallmark thing.
Okay. I'll work on that.
Angela? Hey, my question is, the Steve Carter tutoring program, how do you receive one of these vouchers or how do you apply?
You go on that portal that I have linked
Okay,
and it'll give you all the information that you need. And you'll have to get with the school to get the literacy screener score or your LEAP score. And so the school should help with the parents with getting the information they need to apply for that tutoring voucher. And there's a couple of other states that have attempted to do this and just couldn't get it to parents and and we've had an overwhelming response for parents who say, yes, you will pay for free tutoring, please. And so it's been awesome.
Has the increase, since the first year it's rolled out, I know we questioned it, but has it increased dramatically since the first rollout? And then there was so much funds the amount of funds available were just not being used.
Yes, so if you get our press releases, we actually just released a press release that we now have to put parents on a waiting list, which is like a double-edged sword. You don't want a waiting list either, but we have a lot of folks who are taking advantage and we're using the funds. I can get any specifics that you might want to see, but
I just want to know we had a lot of money just sitting there, so yeah. Any other questions?
Okay, I had another few questions, again, they all overlap. If in the future, it can, or I don't know which bulletin, or I don't know, but clarification on the criteria for behavioral or developmental IEP. And does it fall on an IEP that's under the education department, or does it fall under the Department of Health? And then there's a social worker assigned, and then it goes from coordinated care system for children with developmental disabilities or special circumstances. And let's see. Oh, here's a weird one. Just as the courts require a certified person to be an interpreter for a person that is deaf, hard of hearing in the courts, can something be created that's equivalent to educate the courts for a process in which, because oftentimes parents are the most educated on their child's disability. So a neutral or a mediation type of service or position that can exist to assist the courts with determining what is and isn't correct information. Since there's custody hearings and they're nasty, and then that doesn't fall right back into the education department or the health, it's just that it's a domino. So start at the top. So that's something I was just saying that publicly to see if that's anything has been discussed like that, or maybe it could be discussed with people.
Any other comments? Hearing none. The report requires no action be placed on file. If there is no objection, the meeting will recess for 10 minutes. Do y'all want to keep going?
Yeah.
Okay. We were objected and now we're gonna keep going. So we will now have public comments. The public comments can be on any area of concern or question. Each person will be recognized by the chair and will have 3 minutes to speak. Any comments?
I do have a question. This is maybe for Ebony, maybe for Nicole, but I don't know. So there was a member that an interview that this didn't get conducted until the literal minute. I thought, I wouldn't have objected, but I thought that you had, to make a decision, I thought the chair of that committee had to, either allow or not allow it. I mean, I didn't even know, I didn't understand, what was going on, and I thought, decisions like that were kind of run by the chair or the final say was won by the chair, and I didn't even know what was going on.
I'm sorry you didn't know, Jill. I thought Lauren, after we left executive session on Friday, I thought Lauren came back into the full committee and she said that she had spoke to Christie and he was mistakenly not interviewed. So she said it in front of the committee. I didn't know that you didn't know. So I thought the committee agreed as a whole that it wasn't his fault and he had emailed.
Okay. I'm sorry. Yes.
Do you remember or?
Yeah.
Okay.
And you might not have been on camera. I apologize if you didn't.
Okay.
Any other comments?
I have one.
Lauren?
I'm not sure if we'll get any feedback, but, and Celine, what is the name of the agent? Is it Public Health Standards?
Health standards
Health
section.
Standards. I'd like to maybe, ask staff to reach out to Public Health Standards. It seems like we have a lot of questions regarding how things are enforced. If maybe not to the next meeting or, to have them come and just on for issues like enforcement of different, abuse and things like that. If they can explain to us more or provide more clarity. Into how that works or how they work with the agencies. And what agencies have the power to enforce things and which ones don't.
So there is an initiative in y'all's FY25 action plan where we are collaborating with OCDD on that abuse and neglect initiative that you guys added to your plan. So we have $50,000. We were still trying to collaborate with OCDD on how we can spend that money, that funding. I mean, that's something that we can maybe look into. We can definitely invite them to our meetings, but also they can maybe get involved in that collaboration with OCDD and we can maybe come up with a training because that's what we really wanted. But we're still trying to work out the details and everything.
I don't even know what I want to ask, but I just feel like I'm not informed enough to know what they enforce, how they enforce it, and where an agency stops and they pick up the complaints or issues.
Okay.
Any other questions? Rosalind?
Yeah, this is what I want to know for the next meetings. Is it going to be for next year? in that, or how is that gonna work again?
Yes, Rosalind, they're gonna be next year. Our next meeting is January. You guys just voted. Hannah, can you remind me of the dates now? I don't know. It's the last Wednesday, the 29th and 30th. The 29th and 30th.
Because I lost track how we used to do it in that. So is it like every third Tuesday and Wednesday?
No, it's gonna be now the last Wednesday and the following Thursday.
Oh, okay. See,
Yes.
I'm off track, so I need y'all's help to get me back on track again.
Okay, I sure will. We'll make sure we send out the announcements to you, Rosalind, so you'll have the dates.
Thanks. I would appreciate that so much.
You're welcome.
Ms. Kathy?
Thank you. I have two questions. Well, a statement and then a question. Just to distinguish where health standards differs from OCDD, health standards is responsible for receiving all the reports on abuse and neglect. OCDD does not, so they have no purview over, handling any reports on abuse and neglect. They'll work with health standards, like if a client needs to be relocated or something, to get the client the services they need, or the resident for that matter, if it's like a residential facility. But health standards handles all the complaints. Brian, regarding, you made a note of the shortage of physicians, particularly dentists. I was wondering, does Medicaid do anything to reach out to dentists and other providers to join Medicaid, but dentists in particular to join the adult waiver dental program? Do y'all do any kind of outreach?
I can double check on that for you, Kathy, but I think both of the plans, they do extensive outreach to dental providers, especially in areas where they have shortages. And they really try to get contracts with dentists, but I can get more information on like specifically what they do.
Well, and I'm really interested in knowing whether or not they do a lot of outreach, particularly for the adult waiver dental program, and making sure dentists understand, because this is one provision we made sure we had put in place when the dental task force was working on the laws and what rules and so forth needed to be changed or updated. A lot of dentists expressed concern of having to serve the entire Medicaid population as opposed to just those with intellectual developmental disabilities. So those that enroll in the adult waiver dental program only have to serve adults with intellectual developmental disabilities. They don't have to open up their practice to the entire Medicaid population. And I think that might help if they could mention that to providers that might be interested in serving the developmental disability community, that, they have that option. I believe from what DentaQuest and MCA Dental told us, because they were on our task force too, representatives from both those providers, that yes, they have somewhere on their form that dentists can note that they just want to work with adults with intellectual developmental disabilities. So,
so Kathy, just making it with that outreach, just making sure that the providers are aware of that they can
select just to be a provider of the adult dental waiver program, not the whole Medicaid state plan.
Yes. Okay.
Right. And we still need, this probably is way beyond what you're responsible for, but we still need, yeah.
I'm sorry, your time's up. Is there any way you can email Brian to finish speaking with him?
Okay,
regarding...
thank you.
Oh my God. All right. Anyone else? Tony? You have to unmute.
I'm trying to recall who I was helping out. Can't think now. I know I was helping one of the representatives or somebody in that.
Tony, are you talking, I'm sorry.
Yeah, go ahead.
Are you talking about the self-advocate group?
Yes, I believe so, yes. Something of that nature.
To be added to that group? Is that what you're asking?
Well, I can't recall right now,
Okay,
but I know I was gonna help somebody out. Can't think who it is now.
all right,
So someone can jog my memory.
that's okay. Anybody else? Kelly?
I think he was talking about when, Tony, are you talking about when Julie was given a report and you said you would like to help on
Yes,
that?
that's what it was.
I think he's talking about when Julie was
Okay.
talking about a committee or a work
Yeah,
group.
she had you down. She had you down, Tony.
Okay,
Yes.
That is all.
For the
Self-advocate group.
was it for the thing? Yes.
The KP, the self-advocate group, yes.
Yeah.
Yes.
Yes.
Anybody else?
That's it.
That's it? All right, thank you for your comments, questions, and concerns. Also, I want to remind you that everyone has a meeting evaluation in their packet. If you could please fill that out, and at this time, we will have announcements. Ms. Ebony?
Okay, we just found out the dates for the next meeting, January 29th and 30th, but just keep in mind that the council staff will be working to get your council retreat for the day before, the Tuesday, the 28th. So I'll send more information out about that once we have that planned, but the actual quarterly meeting dates are the 29th and 30th. And please don't forget, if you're a part of and you should be, of either one of our standing committees, self-determination and community inclusion or education and employment, we really need you all to please think about concepts for our 5-year plan. And you have to think about activities for our FY26 plan, action plan. So just keep that in mind. We're going to be looking for those concepts, those ideas for the action plan at the next meeting. And that's all I have.
Right. Thank you, Ebony. If is there any further business? We already talked about next meeting and everything. Hearing none, we will adjourn the meeting. Hearing no objection, this meeting is now adjourned. Thank you, everyone.